These children in Johannesburg live in a care center where they receive treatment that has saved and prolonged millions of lives worldwide. South Africa has the largest anti-retroviral therapy program in the world, but it also has more people with HIV than any other country, an estimated 5.6 million cases. But the number of new HIV infections in sub-Saharan Africa has dropped by more than 25% to 1.9 million in 2010, down from an estimated 2.6 million in 1997. About 2.5 million deaths have been averted in poor and middle-income countries since 1995 due to AIDS drugs being introduced and access to them improving. Much of that success has come in the past 2 years as the numbers of people getting treatment has increased rapidly.
Experience in this field over the last 13 years has been one of absolute amazement in that I've been able to see the effects of these drugs turn around the lives of children and families who, from a point of devastation a decade ago and hopelessness, and despair, where there wasn't much you could do with someone who was HIV infected except watch them slowly die from a disease called AIDS, to now one where children are living and growing up with the disease and are living healthier lives, going to school, going now into even university, and growing into adulthood, from childhood into adulthood, which a decade ago was the exception, whereas now it's the norm.
And it was almost a decade ago when Gail started Nkosi's Haven, a support project for destitute HIV/AIDS infected mothers and children and AIDS orphans. Nkosi's Haven village was named after Johnson's adopted son Nkosi, who died from an AIDS-related illness in 2001. It is a long-term residential care facility and currently houses 95 AIDS orphan children and 35 mothers living with their children. An estimated 40,000 children in South Africa are infected with HIV each year, reflecting poor prevention of mother-to-child transmission. Johnson said the rate of mother-to-child infection is still high in South Africa, likely because of refusal by women to get HIV tested.
I think it has declined a bit, but there's still a huge amount of denial. And that's, I think, part of the problem why we're still seeing the deaths, because people are not going forward to be tested. They're keeping it hidden.
She added that 3 mothers died in Nkosi's Haven village last year because they waited far too long to be diagnosed. They were accepted as residents but died, leaving behind 5 infected orphans. But preventing mother-to-child infection is only part of the problem, as Johnson sees it. She says one of the center's main concerns is to prevent the orphans from spreading the disease further as they grow up.
And what we're finding is our teens who've been infected from birth. We now have an angry young crowd, and you can understand it. They've been infected from birth, they've had no say in their status, and they are now getting to the age where their sexuality is being confronted. Therefore, their status is like in their faces. And it's an issue we're going to have to deal with quite intensely and throughout the country, I think.
Nkosi's Haven is a non-governmental project and survives on donations. Most of the staff are volunteers from South Africa and from around the world. Gail Johnson said the principal aim of the project is to ensure that the residents of Nkosi's Haven learn how to live with AIDS, not die from it, and develop a happy and energetic community where the children could develop and become self-confident, mature, and responsible members of South African society. An estimated 34 million people worldwide has the human immunodeficiency virus HIV that causes AIDS in 2010, according to the latest UN AIDS data. This number is up 17% on 2001, when 28.6 million people were living with HIV. A UN AIDS report says there were 2.7 million new HIV infections in 2010, including an estimated 390,000 among children. Despite progress on HIV treatment and prevention in recent years, sub-Saharan Africa remains the region hardest hit by HIV. Around 70% of new HIV infections in 2010 and almost half of all AIDS-related deaths were in sub-Saharan Africa, even though its population accounts for only 12% of the global total.